head and neck cancer accounts for approximately 65,000 cases in the United States each year. And head and neck cancer starts in the various structures within the head and neck. Our most common type of cancer is squamous cell carcinoma. Patients can feel both local symptoms as well as body-wide symptoms from head and neck cancer. Local symptoms are caused by where the mass is located. This can include pain in the mouth, pain with swallowing, trouble swallowing, changes in voice or hoarseness of voice, and also sometimes difficulty moving the face if nerves are involved by the cancer. Also, they can feel body-wide symptoms like fatigue or weight loss from their head and neck cancer. Traditional risk factors for head and neck cancer include smoking and drinking. We also have two viruses that may cause head and neck cancer, one of which is Epstein-Barr virus, EBV, which can cause head and neck cancers in the back of the nose, and also human papillomavirus, HPV, which can cause head and neck cancers of the oropharynx, where the tonsils and the back of the tongue are. Patients that develop symptoms or present with signs that may be a head and neck cancer are often referred first to an ear, nose, and throat doctor. And that physician will examine the patient and check for any masses or lymph nodes in the neck, also take a look in the mouth and the back of the throat, and do a camera scope in the office to take a look and see if there are any masses that can be seen. Based on that examination, the following may be done. If a mass is found, that'll be something that will need to be biopsied, and that biopsy can be done under anesthesia or sometimes via imaging like ultrasound or CAT scan. And in addition, staging will need to be done with a CAT scan and or PET-CT scan. We have three main types of treatments for patients with head and neck cancer. That includes surgery, radiation, and drug therapy. How we use these treatments is tailored to the individual based on their stage and where their cancer is. Treatments often can include surgery, followed by radiation or chemoradiation, or non-surgical treatment with chemoradiation. We also have minimally invasive surgical techniques that can be used depending on the location of the patient's head and neck cancer. The UPMC Head and Neck Cancer Program is a nationally renowned program that includes leaders in the field of immunotherapy, novel radiation techniques, as well as minimally invasive surgical techniques. It's a true team effort with both clinicians and researchers working together to provide compassionate and top-notch care, and at the same time new discoveries to help improve outcomes for our head and neck cancer patients.